what we're going to do is we're going to introduce Alex, who is kindly volunteered to be my guinea pig today. This is completely unrehearsed, I promised. Myself and Alex met back in January. We were training together and got chatting. And it was just around the time we were talking about putting together this talk. And we just said, oh, yeah, got chatting. So, okay, Alex is an ideal candidate. So I know nothing really about Alex other than our 2-minute conversation just now and our training back in January. We have been chatting over email, so I know that Alex gets kind of tight shoulders into the neck. And she also said she gets tight hip flexors when she runs. And you just mentioned earlier, potentially into the back as well. And when you say hip flexors, whereabouts do you?
More kind of like here.
Yeah, perfect, great. Okay, so onto your back for me, please, Alex. Okay. So now I'm feeling comfortable because this is what I do all day long. Oh, did I not mention the couch? Here's that. Okay, so one of my big inspirations is a South African physio by the name of Doug Hill, and he likes to keep things simple, and I think that's a great thing in life generally, but certainly in sports therapy, physiotherapy, just body work generally. He puts it that your body is trying to do 2 things to survive. Firstly, breathe, and secondly, run away from stuff. There's huge insight in that simple statement right there. So what we're going to start with, we've already looked at breathing. What we're actually going to do now is we're going to look at running away from stuff. So the first action we need to do, I'll come out here, for running is of course this. And for F45, this is quite important. We do a lot of this. Okay, so I'm actually going to test that. I'm going to test it in a slightly different way to the way you're expecting. I'll test it going this way first. How are your hip flexors at the moment, Alex?
Yeah,
they're okay at the moment. If you get any aches, pains, niggles, just let me know, all right? So what I'm going to do, we're just going to bring the leg up like so, nice and straight for me, please, Alex. There we go. Rotate the foot outwards. Hold that there for me. I'm going to press in this direction. If you could stop me pressing, that would be great. Okay, ready? 1, 2, 3. Yeah, pretty good. Not too bad. I could put quite a lot into that. I've already seen what Alex's cheat is. I'll share that with you in a moment. We're just going to do the same on the other side. We'll normally have one side weaker than the other. Mouth wide. Oh no, I'm getting ahead of myself. Stop me pressing. Yeah, and sure enough, so that's quite easy for me to overcome on that side. Okay, let's go back to this side, the right side, because this was quite interesting. I actually saw what Alex is, we're going to start talking about compensation patterns, because this is where things start going wrong. We're going to do the same test, but can I have your mouth wide open for me?
Okay.
As wide as you can. Rotate the foot outwards, point the toes. Stop me pressing, ready, 1, 2, 3. How did that feel, Alex?
Yeah.
A little different?
Yeah.
Okay, we'll do that again. Same test. Now you can grit your teeth as hard as you like. Stop me pressing. And I've got nothing against that. So, what just happened? That's the question. In simple terms, you can all see that she's gaining power and strength by compensating with her jaw. Okay, now why would that be? Here's one I prepared earlier to try and explain. This is something we use at the clinic a lot to try and explain how things are connected. It's not as obvious as you think. We start at the deep end. This is the most complex picture I could possibly show you. All right, so there's no point messing around. So the hip flexor unit is tucked away into the tummy like this. So whenever anyone says hip flexors through here, they're not technically pointing at the hip flexor, but I kind of get what they're saying. This continues with the diaphragm. Now we've already just done some diaphragm workout earlier here today. Yeah, so you can see why the breathing is so important. Firstly in survival, secondly in helping us to run, because that muscle is continuous with the hip flexor unit. Continuous with the lungs as you'd expect for the diaphragm, no brainer, right? We all know that. It's continuous with the heart as well, a little bit lesser known, and continuous with the muscles in the neck. Now if we take Alex as a shining example, that starts to get me interested, because we've spoken about her tension that she gets in her neck. We've already seen that she's compensating with her jaw. If I do that, you can see how these muscles in my neck tighten up. So that's the continuation through there and then into those muscles on the face, the muscles actually close the jaw and clench it shut. I'll just pass that round. I will be doing a test at the end. If anyone can't name all of those muscles, I'll be very upset. But just to give you an idea of how it's connected, it's the same thing from 3 different angles on there. There's loads of other stuff. That picture, incidentally, is from a book called Anatomy Trains. You can read it as someone who's not in the trade. There's some very technical bits, but it's actually quite well written, apart from the bit where he says all British people are sexually repressed, which, you know, I don't know. Maybe he has a point, couldn't possibly comment. Okay, so let's just have a look at the other side and see if we can, yes, so this was the weaker side, wasn't it? See if we can piece together how Alex, or how we can help Alex, or see if Alex can cheat and actually get something to work on this side. So we're going to pop that up, and we're just going to point the toes, no rotation this time. We're going to have that mouth wide open, and stop me pressing. Yeah, not so good. And toes up. Mouth wide open again, stop me pressing. Yeah, not so good. And this time we're going to make a fist. Clench the jaw. Yep, mouth wide open. Stop me pressing. Ooh, only got one last chance. And clench the jaw for me. And there we go. Same again. So same movement pattern on both sides. She's compensating with the jaw. There just seems to be a little bit more weakness and dysfunction on this left side. All right. So what I'm very tempted to do, which would be my normal way of doing things, is I'd now dive in, do some treatment on that diaphragm and psoas, and see what impact that would have. For me, the exciting thing would be we'd do a test in terms of maybe neck range of movement, reproduce the symptoms, release off diaphragm and psoas, and then see if that's impacted the symptoms. A lot of the time it works straight away, at which point I look great, it looks like some kind of voodoo doctor, witch doctor. And then sometimes it doesn't, but that just takes us down to the next line in terms of our investigation. Great, thank you very much, Alex. That's you done for now. I'll bring you down a little bit. So let me just find my space again in terms of where we're going to go to next. And I'll come back around in a second. So let's just come around this way. Ooh, it's way too high now. It's all about being comfortable. Okay, so that just shows you how muscles compensate. And so with Alex, it looks like those muscles around the neck are doing too much work, and that's where she gets the pain, not where the true dysfunction actually lies within her stomach. Really, I expected most people you'll find quite an easy example that you can quickly get back to their symptoms. And when you feel it, you can, because again, a lot of the work I do is quite kooky, but when you can feel it and you can understand it, then that really helps. Right. So we all have these adaptations. I think I saw one person once 7 years ago that didn't have any compensation. It was a 13-year-old swimmer. So, good luck to the rest of us. Life happens, physical, emotional stuff, and it builds up within us. That's just the way it is. Now, the good news is that we can adapt. I always watch Brighton Marathon every year. As a geeky biomechanist, I find it hilarious to see some of the people coming through at speeds that I can't imagine effectively running like this, because they fully adapted to what, because they're just used to it. And that's the joy, because again, we're not perfect. We're never going to be perfect. But the human body is incredibly adaptable. I do a lot of work with, seem to be focusing on 82-year-old people at the moment for some reason. They keep being drawn to me. But even at that age and beyond, we can adapt. We can always adapt, and you can always be better. And that's really encouraging.